Hello, my name is Taylor Erfling. I am a 8th semester nursing student here at Lincoln University. It is January 20th and it is 10:30 in the morning. So what I'm going to be doing today is providing patient education for a chest tube drainage system, including why a chest tube is being placed and just a few things that a patient should really know about having a chest tube in. So to get started, my patient's name is going to be Jerry. And he's getting a chest tube because he has empyema, which is an infection that causes pus and fluid accumulation in the pleural space, which can then cause the lung to collapse, which obviously we don't want that. So putting a chest tube in helps to drain that fluid and helps the lungs to re-expand properly. So I'm just going to go ahead and dive right in. Hi Jerry, my name's Taylor. I'm going to be your nursing student today. I just wanted to talk to you a little bit before the physician comes in. You're going to be getting a chest tube put in because, as you know, you have empyema, that infection that's causing the pus to build up in your pleural space around your lung. It's been causing you to have difficult breathing lately. You've been in a fair amount of pain, your respirations have been higher, your pulse has been higher, and your lung sounds are very congested. So the physician has ordered a chest tube, and what that means is he's going to come in and just make a little incision in your right chest, because that's where your infection is in your right lung. And he's going to basically just put a little plastic tube in your pleural space to help drain that fluid from your infection, just to help make it easier to breathe and to help your lung expand better again, because it's not expanding very well right now. You are going to be awake for the procedure, but the doctor has ordered medications to be given to help ease some of that discomfort that you may experience. He may put a little stitch or a suture in place just to make sure that the chest tube doesn't get pulled out. It will stay in after the procedure is done, and we'll hook it up to a chest tube drainage system. And I'm just going to show you this right here before he puts it in, just so you know what we're going to be dealing with. Okay, so we have 3 different chambers here. The first chamber is called the suction chamber, and they can use either basically dry or a wet suction for this if the physician orders it, and it just helps to pull fluid a little bit better, with that additional suction from the pleural space, which is where you have all of your fluid buildup. If suction is ordered for the patient, or if the suction is ordered for you, Jerry, then I'll have to go and get a thoracic suction system, because it's not the same as the one on the wall. So I'll have to go and get that and add that to your system to help your fluid be suctioned off properly. The next one we have here, this is called the water seal, which, let's see right here. This right here helps with your water seal. I fill the fluid up to 2 centimeters, and that helps to seal the chest tube and the drainage system, which during the procedure we are also going to place a watertight sealed dressing over your insertion site as well, just to make sure that no air is getting in there that we don't want. We want this system to be completely closed. So if you ever see any bubbles in this area, make sure that you put your call light on and let your nurse know, because we don't want to see bubbles in here. We just want it to be just plain water. Okay. All right, and then this section over here, this is the collection chamber. So whenever the fluid is getting drained from your pleural space, it's going to start filling up over here. And at the end of each shift, a nurse is going to take a Sharpie marker and mark wherever it filled up to. So say it got to 80 in 12 hours, we're going to mark it at 80. We're going to initial and sign and date it. just so that the next nurse knows where to measure from. So, and that just helps us to know how much fluid is being drained from your pleural space, how quickly it's being drained, just so we can get an idea of how well this is working for you. Now, if this drainage system gets completely full, what we'll do is get a new drainage system out just like this one, and we're going to replace it. We're never going to just drain this and then hook it back up to you, because that can cause problems such as like lung collapse, because it's not the right pressure for the system. So whenever this gets filled all the way up, what we'll do is replace the system. We'll take this one and we'll put it in one of those red biohazard bags and take it to the dirty utility room. We won't just drain this and then hook it back up to you. That's not safe. So once we get all of that done, it is very important that, Jerry, that you understand you need to put your call light on if you need to move around in bed, if you want to get up, if you have to go to the bathroom, because this system is very delicate. We want to make sure that this doesn't tip over or slide over or anything like that, because it can disturb this water seal here and cause complications. So you would have to let your nurse know immediately if for some reason the collection system tipped over on accident or whatever. Make sure you let me know immediately. It'll also make it harder for us to keep track of the measurements here, because the system, if it tips over, can flow into these other areas, and then it's much, much harder to keep track of how much fluid you've actually drained. So make sure you put your call light on if you need to go to the bathroom, you want to get up and move around. It's very important to let me know that. And as a final thing, Jerry, before we get done here, after you get your chest tube inserted, you want to make sure that you're doing coughing and deep breathing. And that is so that we can help that lung re-expand to as large as it is supposed to be now. Coughing helps, cough up any of the fluid that you may have that's in your lungs, and it helps with chest expansion. And then the deep breathing helps that lung to re-expand as that fluid is draining from your pleural space. So you want to make sure that you're doing really good deep breathing a few times every hour. And I can get you incentive spirometer to help with that, and I'll teach you how to use that as well. Okay? All right. So, if Jerry had any questions, I would address them at this time and make sure that he is in a completely safe place, safe area, and then the physician would come in and do the chest tube, and then we would probably review this information again after he was in a point of more comfort, just to make sure that he really understands what's going on. Chest tubes are usually in for about 2 to 3 days, and then are taken out again by the physician. But that varies from person to person. Some people have them in longer, some people not as long. It all depends on how he's responding to the treatment and how much fluid accumulation is in there. Okay, thank you.